The impact of workplace fatigue on occupational therapists. Sleep is an essential component to one's overall health and well-being. Everything we do is influenced by sleep, and yet it is so often overlooked. Sleep can be viewed from a biopsychosocial lens as it influences and is influenced by biological, psychological, and social factors. Some of the physiological or biological factors influenced by sleep include healing, digestion, hormonal activity, central nervous system and prefrontal cortex functions, sensations, along with muscular strength and coordination. Psychological factors impacted include perception of well-being, concentration, attention and alertness, learning and memory, problem-solving and insight, emotions and affect, levels of anxiety and stress, aggression, along with paranoia and sensory perception. Social factors influenced may include interpersonal communication skills, empathy, social awareness, behaviors, and interactions. Now that we have established the factors that sleep may influence, we can speak about the short and long-term effects of fatigue. Some of the short-term physical effects of fatigue may include falling asleep against one's will, reduced hand-eye coordination, visual perception, and reaction time, failure to respond to stimuli and changes in our environment, errors in repetitive tasks and incorrect responses, increased muscular tension, increased appetite, and altered glucose metabolism. We may experience the following short-term cognitive impacts of fatigue: difficulty concentrating, becoming easily distracted. We may have slowed thought processes, poor judgment, logic, and decision-making, reduced vigilance, decreased emotional regulation leading to irritability, loss of empathy, reduced capacity for interpersonal skills and communication, decreased motivation, reduced memory and learning capacities, along with an increased impulsivity and tendency for risk-taking. Socially, we may experience ineffective interpersonal communication, decreased social awareness, loss of empathy for others, increased rates of divorce, strained relationships, along with domestic abuse and violence, and a decreased ability to relate to others. Long-term health effects of fatigue may also be experienced, including elevated stress hormones, high blood pressure, gastrointestinal disorders, increased risk for heart disease, stroke, and type 2 diabetes, obesity, fertility problems, hyperplasia, increased risk for new or recurrent psychiatric disorders such as anxiety or depression, chemical impairments, substance use and abuse, along with increased susceptibility to illness and increased rates of infection and cancer. Okay. So how do these short and long-term impacts of fatigue affect you at work? You may find that you have decreased productivity throughout the day. You may experience a slowing of your thought processes along with poor insight, judgment, and decision-making. You may experience reduction in your task completion and find yourself making very simple mistakes on things that you do on a daily basis. All of these things may lead to an increase in patient care errors. You may notice that your communication becomes ineffective. You have reduced empathy for others. You may miss environmental cues and fail to respond to environmental stimuli. Decreased safety and increased risk-taking behaviors can lead to an increased occurrence of accidents and injury. You may miss more work days and use more healthcare resources. Okay, so let's put things into perspective. Being awake for 17 hours is like having a blood alcohol level of 0.05. By 24 hours, this is like a blood alcohol level of 0.10. Only 2 hours less than optimal sleep over a week can lead to a reduction in work performance equal to 24 hours of wakefulness. 5 hours of sleep a night over 6 nights can induce a pre-diabetic state. 5 hours or less of sleep a night impacts our ability to regulate our emotions. Microsleeps can lead to accidents, serious injury, and death. Many major workplace accidents have been attributed to fatigue. At the end of the day, insufficient levels of sleep put not only your own health, well-being, and safety in danger, but also that of your coworkers, families, and your patients. For further information, please visit the following links.